Doctors of Reddit, what's the biggest case of faking it you've ever seen? We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. Dermatologist here. Patient was convinced she had a melanoma and needed a biopsy and would need to be on workers' comp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an alcohol swab and showed her the ink and that there was no spot on her skin anymore. She stormed out threatening to sue. I'm just glad I cured her melanoma. Whenever we had kids, usually teenagers, playing up their symptoms to extend their hospital stay, we would order them into a healthy lifestyle. Lights out at 9. No screen time for 2 hours before bedtime. Healthy diet chock full of fruits and vegetables. Screen time limits. Minimum number of laps around the unit per day to get in their exercise. They got better so much faster with our healthy lifestyle tips. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk. Hips swaying, full stride, going places. We were all fools. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests, didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. Didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk, so I update them saying everything is fine. Tests are negative. You can go home. Patient gets up, gets dressed and walks out without a word. My brother was an EMT for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. Sorta along the same idea. Working at a pharmacy, we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated "hello" wave. She started to throw her arm up to but caught herself halfway through. Then threw her hand back into her lap and pretended to be staring off into nothing. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking. Tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course his eyes were back to normal and focused. One time my roommate, who is an ICU nurse, came to see one of my indoor soccer games. During the game, a player on the other team went down, hurt, and starting screaming in pain and swearing and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game brooding in silence before he left early. After the game, my roommate told me he was going to go over and see if there was anything he could do to help, until he saw that the guy was limping on the wrong leg. I once saw a patient who had been faking paralysis of the legs for years, used a wheelchair, never walked, etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family, friends were just going along with it, not sure if it was really conversion disorder or if the patient had some secondary gain issue. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the Tonapen, a device you poke them directly into the eye with, and they go, "What the fuck is that thing?" Obligatory, not a doctor. I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc. How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on insurance form. Doc loses his sit in staff room laughing. Next week the patient loses his sit in reception because his insurance has been cancelled. Guy came to I was a nurse at the time. For stomach ache, when asking him about history, he randomly mentions a fight with his girlfriend where she left in a tizzy and he fell asleep on the couch. 20 minutes later, when we see the CT, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. Nurse. Bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. When I was a medical student, I worked in the pediatric side of the emergency room, and we would give popsicles to all the kids. One afternoon an 8-year-old came in with his father, and I asked what was wrong. The kid couldn't remember what he complained about to his dad, and the dad couldn't remember why he brought his kid in. The kid's mom was a nurse. She was working at another hospital at the time, and she was the one that would keep track of these things. Anyway, after a few minutes trying to figure out what was going on, the kid asked, "So, can I have my popsicle now?" The kid was 100% healthy. Unfortunately, we reinforced bad behavior and both the kid and the dad subsequently left with popsicles. I'm a surgery resident. When I was on my trauma rotation, we had a patient come in after an MVC with question that maybe the patient had seized and that had caused the accident. So he's in the trauma bay and starts shaking. The trauma nurse goes, "Oh, this isn't a real seizure." And the patient stops shaking, sits up, turns to the nurse, and yells, "You don't know a frocking thing about me." Not a doctor, but I was in the one night and there was a seeking drug addict who literally only acted in pain when there was staff around. You ever see those videos where the little kid is fine and then they spot a parent and then bawl, then immediately stop and be fine when the parent is out of view? Exactly like that. Sat fine. No movements or wincing or noises, then wailing when a nurse was in the same vicinity. Then back to fine when they left. Not a doctor but nurse. I once read a specialist's consultation report, and at the end of the report the actual diagnosis given was fictitious ailment. I had a patient when I worked in an ICU that was sedated and on a vent. A family member showed up out of nowhere and was staying day and night. I got pretty suspicious of them because they were clearly lying about knowing this person. Just talked to the fake family member about how it must have been sad since they just celebrated their birthday a week or so before getting ill. This person said it was a wonderful party and such, to which I replied their birthday hadn't occurred yet and wouldn't for months. Turned out when security came, it was a homeless person who snuck in and found a room with a sedated patient and decided to make it a place to stay. Needless to say, security to enter the ICU was absolute sit. Prisoner came in with signs and symptoms of a big stroke. At that time the protocol was to get a non-contrast head CT to rule out a bleed and then give TPA, a powerful clot-busting drug that's only worth the risk if the benefit is to mitigate a major stroke. So that's what happened. Later in the course he got a little carried away and started embellishing his story with symptoms that didn't make sense with his stroke diagnosis, and that's how we figured out he was faking it just to get some time away from jail. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. Edit. Yes. Sternum rub. Got it. Not me. But no, an army doctor who prescribed everyone with cold-like symptoms or sore legs to stay in bed for the whole day. Then next day half as many people with symptoms showed up. My EMT instructor told me he and his crew ran on a seizure call. Gets there. Doors wide open. Female patient is unconscious and buck-ass naked. They start assessing her while one guy clears the house to make sure no one else is inside and gets something to cover her. After doing an arm drop test and trying to check her pupils, they all figure out that she's faking her illness. However, their general policy was never to openly state that, but to just roll with it instead. In line with that, He starts to call for an ambulance to come take her to the hospital, when one of his guys says, "Captain, she's clearly faking it." Then this woman, who is supposed to be unconscious and unresponsive, says, "No, I'm not. When I was a kid I learned I could fake sick and get out of school, so 1 to 2 days a week I would get a migraine and hold my head and complain and I would get to go home. Eventually my parents took me to a neurologist who said, maybe you just don't let him eat chocolate and sugar." I admitted to faking and was grounded for a long time. Patient registers with chief complaint of dental pain, allergies to every known NSAID. Yes, I know this can actually be genuine, such as with AERD. This is a small rural hospital, so I happened to see this guy go across the hall to the lounge and help himself to a big mug of hot black hospital quality coffee and proceed to drink it in the waiting area. On asking about the dental pain, he reports that the pain is severe and worsened by drinking cold or hot liquids. His head and neck exam is non-acute, and he is discharged to home with instructions for supportive care including ice packs and follow up with his dentist ASAP. His dissatisfaction is loud and salty. I saw a father and his son wink when I was turning to face them again when I was done writing a note to stay home from school. That's pretty much it. Faking it is a hard call to make in general. When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom, just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells and both me and my dad ended up puking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. When I was a kid I used to fake sick for no other reason than I wanted to stay home and hang out with my grandpa. He knew exactly what I was doing and would 90% of the time make me go off to school. We lived with him. Every so often though, he'd wink at me and we'd convince my mom I was feverish, and then spend the day together watching movies and being best buddies. I was like 9 or 10. I cherish those days because he passed away when I was 19, now 31. I would give anything for one more of those days. My mom's an nurse and she said once some crazy lady came in and complained she had the whooping cough, and whenever she coughed she followed it with a loud whoop. No doctor, but a funny story from work a couple years ago. Guy calls in sick for around 8 days. Says on the phone he is really sick. Comes back to work the next week. Tandas F***CK. This dude hands a medical slip to the manager written in Spanish. On the slip there is an official seal from some random Cuban clinic. Guy walks over to B with a grin on his face saying, "Yeah, I'm probably fired." He was fired. 30-year-old woman came to the ED with such excruciating belly pain, paralyzed. "Oh God, it hurts when you press there. Must have oxycodone now." ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. A few years ago I hated my boss, so I would have lots of migraines, headaches too severe to head into work. After seeing the same doctor a few times he referred me to get a MRI brain scan. I played along. 3 hours later I was rushed to ED at my local hospital due to having 2 lower brain aneurysms. I never had those headaches. I was faking them. Bit of a blessing in disguise, I suppose. Former scrub nurse. Patient was on the table having a minimally invasive procedure. Carrying on and asking for more and more versed in fentanyl. She was already maxed. She had a tolerance despite claiming to have never had narcotics before. Suddenly begins yelling, "I see the light. I see the light. Does anyone else in here see that light?" 6-4. Mountain of a man circulating. Nurse gets in her face and says, "No. And neither do you. Now be quiet and let us do our job." Patient calm, normal vitals and resting comfortably. Not a doctor but a nurse once had a patient having a seizure. The other nurse and I knew she was faking it. He said as much. She suddenly stopped seizing. Miraculously. Looked straight at him and yelled, "Shut up, fat boy." He and I laughed so hard. He, the other nurse, was referred to as such, fat boy, for few months after that. At least she wasn't having a seizure. Edit. Spelling and clarification. Patient and a family member coming in stating that patient has epilepsy and needs benzos. While gathering basic history the patient starts having a seizure, rolling on the ground, head shaking and feet kicking. I asked the patient if he needed any help during the seizure. He responds back saying he is experiencing a seizure. Family member is obviously trying to convince me that patient is having seizures like this every day and needs benzos. I kindly told patient and family member this is psychogenic non-epileptic seizures and he needs to see a psychologist for an evaluation. They had a hard time believing this condition and walked out. Had a woman bring in a kidney stone she passed and said she was in agony with another stone. She ramped up the analgesic ladder until she was on opiates. Pethidine most likely. All he scans came back negative and we had the stone she brought in analyzed. It came back as being quartz, not a mineral that occurs in the body. When confronted with this fact she quickly left. 6 months later and I'd rotated to another nearby hospital. A woman came in with abdominal pain and I went to see her. We locked eyes and instantly recognized each other's. I said nothing but she knew the jig was up and self-discharged. I'm an ICU and nurse. We get a lot of malingering in the One day, one of our frequent flyers came in and started faking a seizure in triage. Now obviously I know this lady and she's fake seized a million times before. But this time it's in the lobby in front of about 30 people, who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing. So she did. Edit. No. Her name wasn't actually Karen. I just did that for confidentiality. Mom was complaining all day about abdominal pain. It proceeded to get worse. So my dad and I drove her to the We get to the front entrance of the and she proceeds to rip the loudest fart ever. Not really a faking pain type of thing, but it's funny. I work in occupational health. I'm an athletic trainer. Not a doctor though. I once had a guy come in complaining of back pain. He hobbled into my office walking 1 inch at a time and groaning in pain. I knew he was faking it when I hardly touched 10 different areas on his back and he howled in pain. I looked out the window to my office and saw about a dozen baby turtles crossing. I called out for him to come look. He jumped off the massage table and sprinted over in awe of the baby turtles. I told him to get back to work. Dentist here. Had a patient complain of toothache which required extraction. Did extraction and patient left in good health. Patient called within 20 minutes of leaving saying they were in the worst pain of their life. 11/10 pain and requested a script for oxycodone. Patient came back the next day in tears. Shambles. I start to feel bad because it looked like they were in genuine pain. Take a look in the mouth and everything is fine. Healing is normal. And once again, they request oxycodone. I say no. We need to think of something else, and that is where it changed. When I declined giving a strong narcotic they flipped the switch and became violent, yelling, throwing instruments, had to be escorted out. This is where I learned drug seekers will do anything to obtain what they want. Here is the opposite scenario. I went to the emergency department for like the second time. Incredible stomach pain that I couldn't place. The nurse casually offered me oxy and looked really surprised when I turned them down saying that it won't fix this pain in my stomach. Like they were expecting me to be like, yeah, that's the reason I'm here. Not a doctor. I do work in medicine. Saw someone come into the and after throwing themselves downstairs for opiates. Miraculously they were fine except they completely frocked one of their knees. We offered them physical therapy and a knee brace. They were extremely unhappy. I always had a hard time lying. Probably due to being on the spectrum. So when I wanted to get out of school as a kid I'd always would hit myself in the stomach with my fist to not be lying about having a stomach ache and wanting to go home. Looking back at it they must have thought I was a victim of horrific bullying but nobody ever said anything about the bruises. Looking back at it, this is horrible in so many ways. Nad. But I heard a story of a local prisoner who came in complaining of sharp pains in his stomach. He claimed he swallowed a nail. X-ray indeed showed a small nail lodged in his body. Turns out he taped it to his back. Wasn't trying to trick the doc. Just needed some fresh air apparently. I saw some real terrible Munchausens via proxy. A young teen was heavily germophobic and has nervous obsessive compulsive tendencies. Very paranoid and always thought he was sick. Turns out, his mother was not only encouraging this, but actively shaping it by excessive discipline if the teen's room was not spotless. Subjecting him to scalding bathes and such. Not necessarily faking it. But he definitely wasn't sick. He just had a monstrously sick mother. I'm a doctor. I used to tell stories about things like this, but lately I've come to realize that many people who are faking it have a severe psychological trauma, e.g., child sexual abuse, which is manifesting in physical symptoms, or some other bad cause for their factitious disorder. Even for the malingerers too. They're usually in a terrible place in life despite how much fun it is to read about their stories. We should treat both types of people with compassion and understand the circumstances that brought them to that place in life. I totally had a patient who nearly killed herself injecting her own poop into her skin though. That was pretty wild. I'm sure there are doctors on Reddit, but they are probably hesitant to talk about their 6 lives. Radiographer here. I was X-raying a guy in his 30s who claimed that he has fallen down a hill and broken his leg. He crawled to his father's garage, which was apparently by said hill, and laid on the floor for 3 days until his father found him. This was in the heat of summer, 30°C plus. And yet somehow this guy smelt fresh as a daisy. No bow, no urine, no feces. He moaned and groaned the whole way through the exam. Except when he thought we couldn't hear him. He somehow managed to get a 2-day hospital stay out of it. Nothing wrong was found. Pseudo or psychogenic seizures are an interesting phenomenon. Had a patient once, seizing, who I sternly told to stop. They proceeded to keep seizing while yelling at me. I can't stop. I'm seizing. Pro tip. Can't have a grand mal seizure while having a conversation. Edit. To address a couple comments. Absolutely. Psychogenic seizures are not voluntary and carry a high morbidity. In retrospect, I should not have included that term with the story I described, which was likely someone malingering for gain. Benzos. Dang it. I've been waiting for this and it'll probably get buried because I'm late. 13 to 14-year-old girl came in for spontaneous bruising and pain in her medial ankle, calf. Symptoms come and go sporadically. Mom was really concerned. No trauma history. Look at the leg. The bruise was shiny, shimmering. I grabbed an alcohol-soaked gauze and wipe off the graphite from a pencil. Girl was mortified. Mom embarrassed. Obviously done for attention. Strongly recommend a psychiatric evaluation to mom. Patient faking seizures so doctor was taking a history. Doctor. Double vision? PT. Yes. Doctor. Close the left eye. Still double vision? PT. Yes. Doctor. Close the right eye. Still double vision? PT. Yes. You asterisk wouldn't have double vision with one eye closed in this particular scenario. Bless. 1. Edited for clarity so that maybe people stop replying to me with their self-specific anecdotes about double vision. Lol. In this particular case, the patient also caught herself as she fell during her seizure and gently lay herself down on the floor so that she didn't get hurt. Mom's a nurse. She had someone walk up to the counter. Definitely on downers, all slurry and slow. Just starts talking casually about how she's in so much pain and needs painkillers. From what I understand, it's a pretty normal occurrence. On the other hand, my GF had 8 teeth extracted at once and got interrogated when picking up pain meds 3 days after surgery. Also have a friend with severe back pain from an age-old injury. He has a lot of trouble getting meds despite trying to make them last as long as possible. Not a doctor, but once when I was a young kid I decided I wanted glasses. So I pretended that I was seeing double while I was at school. The teacher noticed me bumping into people in the schoolyard and called my mom. My mom knew I was faking, but I was adamant, so she took me to hospital. I ended up staying for 3 days and having an MRI scan to find out what was wrong. Did not end up with glasses. Very embarrassed about wasting hospital time now, but I was like 7 years old. Had a patient faking seizures in our small community. Got the MD to agree to intubation for airway protection. Enter the caretaker, who whispers to the MD and myself that the patient fakes them often when he wants to make the caretaker upset, anxious, hurt. MD and I stepped out and he asked for a carafe of ice-cold water and a saline flush. Upon MD instruction, another RN was to shoot the ice-cold saline into the patient's ear. Patient jumped up out of the bed and swung at the MD. Seizure cured. So I'm not a doctor, but during my sophomore year in high school, a freshman came in with a blue sock wrapped around her foot, calling it her cast. She walked around on crutches but didn't actually lean on them for support, walking completely normally but moving her crutches forward and backward like a little kid exaggerates, swinging his arms back and forth while running. Obviously fake, which pissed the hell out of a few kids at my school that actually needed crutches. When one of them went up to her and tried to tell her what she was doing was wrong, she screamed, "Stop mocking my disability," and threatened to report them to the school guidance department. Quite the attention seeker. Patient with seizures. My fellow says to family members, "Don't worry, normal seizures are accompanied by sphincter relaxation and urination, followed by patient wetting the bed instantaneously." I'm not a doctor, but I've been to 2 different drug and alcohol rehab centers, and the number of clients that suddenly sustain an invisible life-threatening injury and need high-dose painkillers is incredible. I'm sure many doctors, nurses, paramedics, MTs, or whoever have enough stories of regulars to fill books. We have a lady who is utterly convinced that her turning her leg slightly inwards is enough to fool anyone that sees her that she has a dislocated knee. She'll sit for hours waiting for a low-priority ambulance. Unable to walk, she fails to remember that she's called so many ambulances that literally everyone knows who she is and so knows about her bullshit. She's managed to hit the frequent flyer mileage level of being refused any ambulance unless dying. Once when I was an intern in the neurology ward of my university hospital, a woman arrived in a wheelchair asking for a certificate that would guarantee social benefits due to her disability. She told us that she had no lower body strength, but without any apparent reason or other symptoms. When we tried to get her to walk, while we held her hands, she would suddenly fall, but without ever hitting the floor. So my teacher decided to try to distract her attention by talking about her life, and we realized that she was able to stand up effortlessly. She didn't get her certificate. I had a doctor accuse me of faking feeling like sick and wasting everyone's time. The nurse came in after and we were talking, and she asked if I had started any new medications. Turned out that what I was experiencing was a bad reaction to antidepressants, and they were making my body feel like it was dying. So thanks to nurses for listening, and frock that hospital for overworking everyone to the point that the doctor didn't have time to figure out it was my medication. Conversion disorders are really interesting. Not sure if qualify as faking it since the patient thinks it is real. Not a doctor but come from a family of nurses. Dinner time was the best for stories. Myself and my mom's side legitimately have Ehlers-Danlos, and I have fibromyalgia. A relative constantly insists she has every single illness, to the point that we've all queried Munchausen. But my favorite was when she said to my face that she had had a blood test and it came back positive for Ehlers-Danlos. You generally get diagnosed by a geneticist etc., not by a blood test. Many tongues were bitten that day. Not a doctor. But I worked at a summer camp and was around the nurses building a lot. We'd have homesick kids faking all the time to try and get sent home. Or a kid that didn't want to go to a session staying there just long enough to miss it. But the best faker was one who said something was wrong and needed to stay there. The nurse goes through the usual questions, and then asks how he's been eating. Kid says he hasn't eaten anything from the dining hall, and has only had slushies and candy all week. Nurse makes him go get one of his adults there, who doesn't allow the kid any junk food for the rest of the week and watches him like a hawk in the dining hall afterwards. I worked in an ER, and one of the doctors came over to a man in one of our red rooms because his wife was crying hysterically. The man was thrashing about like a fish out of water. Through her tears his wife screams, "He's been having seizures like this for hours." The doctor says to her, "He's not having a seizure. Don't worry." Doctor simply taps on the man's foot and yells, "Hey, knock it off." The man just stops his ridiculous convulsing and sheepishly looks at his wife and the doctor. Doctor smiles at her and says, "See," and walks away.